Good morning everyone. Myself Jagadeeshwar, Assistant Professor from Occupational Therapy Department. So today we are going to do the demonstration about this wheelchair and wheelchair skills and all. Okay. So in this, if you are seeing wheelchair, definitely we have to know the parts first. So what is the parts? First, push rim will be there, and sometimes this brakes also will be available in this, and backrest will be there, seat will be there, footrest will be there, and brakes eventually will be there. Tires will be there, push rims will be there, and spokes will be there. And if you see the central part, that frame, this frame. Okay, so why this frame is also important means ultimately we have to fold this thing so that we can take it out anywhere. So that is the few things. And another one thing is this anti-tip bar, so that we will give pressure here and we can lift the persons to do threshold clearance if the person is not able to perform it by themselves. So now we are going to see about how the wheelchair skills has been done. Okay, so if you see the wheelchair skills are like basic, intermediate and advanced skills. So most of the skills I will just demonstrate to you guys also. So first of all, first skill is just roll forward like little by little. Okay, then roll backwards, so little by little, then go rolling towards 90 degree, towards either left or towards right. Okay, then while moving forward itself we are turning, and moving forward itself we are turning to the next area. So after that, while going backwards we are turning, and going backwards itself going to the both directions, vice versa. Okay, so after this, one of the main skill also we have to learn is like rotating at a stationary area. So rotating 180 degree, so on the same space. Okay, so it is very simple that we have to hold one side of that wheel, so that opposite side, if you are going to left side, you have to only push the right side so that it will go towards left. The same thing, if you want to turn towards right side, just make your wrist very stable towards the right rim, then push the left rim so that you will turn eventually. So the next one of the main skills as a spinal cord injury patient, mostly we know the spinal cord injury patients only is going to do this one. So if something is falling down, so what are the skills we have to do? Ultimately the person has to go this side and they will put brake, then sideways reaching we have to teach the person. Not only the sideways, if it falls front also, the person has to bend and take this forward. So for this the person needs more stability also in their trunk control. So this is one of the main factors. After this, one of the main thing what spinal cord injury patients will use means, because this spinal cord injury patients will be sitting there for so long in this wheelchair, so definitely that we have to relieve the pressure relieving also. So just put a brake like this, and there is two techniques are there to do this one. If the person is having more strength in their triceps and latissimus dorsi, ultimately the person can do pressure relieving technique like this, only usage of that upper limb strength, not the usage of any lower limbs, and they have to hold it for like 15 to 20 seconds, depends upon their need, and they have to do it very frequently so that the pressure won't go, otherwise the person will have pressure source in their gluteal region. And there is another relieving technique is there nowadays. It has been very common because the previous one needs more strength for the person to push up, and sometimes it takes more time for the person. So ultimately what nowadays we are telling is, so just lean towards one side. So if we are leaning towards right side, ultimately our left gluteal muscles are getting popped up, so that makes a person's relief. So do the same thing towards this side also. So if you are doing this one, so this opposite side is getting relieved now. So like this we have to go for like 15 to 20 seconds so that the pressure is getting relieved, so that the person can be there and do their works in their wheelchair so long. Now we are going towards little bit intermediate levels kind of things. So the person has to do this one definitely. So one of the thing is called wheelie. So wheelie means, I will just do it once. So like this, just popping up the wheel, the front wheel in air. Okay, so it needs more stability, and I will just demonstrate how you guys also can hold it like this. So it is very simple that first you have to give pressure in this push rim, and like 1, 2, and with the force with that wrist you have to pop it up like 1, 2, 3, like 1, 2 and 3, like this. So after this you have to hold it in certain way. We have seen the wheelie, but before wheelie there is one other thing we have to do it first. So that is called pop-up. Just lift like this. Okay. So you just have to give pressure and you have to lift that upper caster wheel and should go. Why it is very much needed is, so if there is any threshold kind of things are there in our home, so that the person can go like this, at the time they will pop and they will push and they can go move forward. So that is the main thing. So before going into wheelie, definitely the person has to do this pop-up culture. Okay. So, and this is a stationary wheelie we are talking about, and there is another movement also is there which is somewhat difficult, but you can do it with your practice. So with wheelie itself, the person has to turn towards this side like fully, but it needs more patience, and the person has to be very cautious about the person what we are doing it, and turning towards this side like full rotation the person has to perform it. Okay. So while we are doing this one, so we are talking about how to do this wheelie, and previously I talked about how to do it also, but I missed out some few things. So what the thing is, so when we are doing this wheelie, when it goes up, there is one mechanism everybody has to learn. So when I am pushing my wrist towards front, ultimately my wheelchair goes back. So if you want to come little bit front, so I have to push it back. That's why most of the peoples will fall while doing this wheelchair. So if I go like this, little bit if I am doing like this, so with tension for the first people, what we'll do, we'll push even more front. So but it makes the wheelchair go backwards only. So the fall is very much common with those people. So always have in mind that if you want to go towards back, push front while you're doing wheelie, and if you want to go a little bit front, you have to push towards backwards. This is one of the precaution measures we have to go it with this wheelie concepts. So now I am going to demonstrate how we can transfer from wheelchair to chair, because the person cannot sit for so long by themselves. Okay. So the person has to do this leg with their hands, and they have to move again. Then they have to come little bit closer. Okay. So this whole things I am not using any of the power of my lower limb, only with the upper limb only. So afterwards one hand should be with that wheelchair and another opposite should go with the chair. So I will give pressure, then I will move my whole body and I will sit in a chair. The same goes with the other things also. From chair to wheelchair, ultimately if I am sitting from here, so I have to reach my arm towards that wheelchair, then I will bend little bit, then I will give pressure, then I will move forward and I will sit it in the wheelchair. This is the easiest method to perform. So previously we have seen the transfers from wheelchair to chair. Now we are going to see how the person can do the ground transfer. So the person wants to sit from wheelchair to ground. So how we are going to do? So first of all, like the same thing I told. So front you can push the leg, then afterward the same thing again. Only I am using upper limb now, not the lower limb at all. So we have to come little bit forward. Again you have to make sure the leg is going front like this. Then keep your pressure towards this wheelchair and slowly sit down. This needs pure upper limb strength. So while coming back also, give the pressure towards this one and go like this and you can come up. So but it needs more triceps power and latissimus dorsi power. So there is another one thing also is there. So now I did the transfer to the ground in forward. So the person can do it in sideways also. For that the left hand should go to the right side. So they will go like this and they will sit like this. Then afterward the same game. So you have to give pressure. Then they will drag their body like this and they will sit it here. So these are the most commonest thing the person will do it in spinal cord injury. So now I am going to demonstrate about how the wheelchair is getting propelled. So there is 4 main types are there, but at the scenarios only 2 is more common with everybody. So I will just demonstrate. So first one is like a arc. Only I will do little bit movement only I will do, like this, like this, like this. The same goes like, I will turn, I will little bit only I will come. So what's the problem with this type of propulsion is, because we are keep on doing this, there is more prone of having that person's shoulder impingement may occur with this patient. Okay, so we'll go with the next type of propulsion now. So the next type of propulsion is like semicircular. So I will start from this midpoint, so I will go like this, then like a circular, only here, only here, only here. Okay, so if I am doing like this kind of semicircular, so I can cover the distance also so far. Just look at here. So if I am doing like this, so the wheelchair is getting covered, so the distance also is getting covered, and I am giving very less energy only here. So that's what, this is one of the important and mostly used type of propulsion. So the next one is single loop. So I will start from here, I will do here only. So like this hand will come. Okay, so this is mostly done by the persons who is in athletic field. So another one is there called double loop, like a 8 pattern it will go. So only simple difference only will be the double loop. So you have to go like this, my hand will come like a 8, again go like this, it will come like a 8, again go like this, it will come like a 8. So we'll see in the front view also. So I will push like this, then my hand will come, again push like this, my hand will come, so again push like this, my hand will come. So if you see like an infinity symbol it will go. So it starts from here, I will go like this, then I will come again here. So it goes like this, again one loop, again I will hold here. So this is the difference between this single loop and double loop propulsions. There is another one basic skills called sideways maneuver. Maneuver means just moving towards one area to another area. So how we can change this, like with this wheelchair towards this and this, like this. So it's very simple, you have to go a little bit front and you have to pull towards other side. Again you go, again like this, like a string kind of things, so that you won't cover that much area to go forward also and backward also, but yet you will go in the same sideways. Same goes to this way. So it's like a front pull and back, front pull and back, and front pull and back. So why this sideways maneuver is very important means this person have to use this wheelchair in home also, so that they cannot shift that other objects which is already there. So they have to adjust themselves and they have to move. So that's why this sideways maneuver is very important. So next we are going to see how the person has to do that obstacle coursing. As occupational therapist, I will train the person to be very much independent. So in outside, like in community also, and towards in home also. So what I will do, so I will just give like a task which has more clutter kind of things, so that the person has to perform and they have to adjust themselves like this. So because all the objects in their home will be like the same area only, so they should not touch any of the objects, yet the person has to move from this side to that side. So like this also we have to go. We just push, we won't touch here, only usage of pure wheelchair skills we have taught before with this patient. So this is one of the main things we'll just do before that person is getting discharged. Now we are going to see how we can transfer by one person's by climbing upstairs and downstairs. Imagine this person is a spinal cord injury patient, so that person cannot climb upstairs and downstairs with a wheelchair. So definitely he needs help now. So what we have to do, just first we'll turn this person towards the edge of this one. Then I will pressure this anti-tip bar so that it goes to wheelie. So then come to the edge, then I will push the person up. Again the same thing. Okay, so it goes with the same level with downstairs also. So first little bit slowly I will put down, then again little bit front. Okay, so while we are doing, we need the help of this paraplegic patient also, so that they will control this wheelie with this rim. So the next thing is, the person is sitting here, but the person has to move from outside. I already told as occupational therapist, so I want the persons to perform movements and through independently they have to do, right? So I'll just go forward like this, and I will just put brake if I need. Then I will open the doors and I will go in this itself. Afterwards it will come back. Again I will turn. Little bit, then I itself will lock the doors. By this the person will be independent in their opening the doors and they can do their daily life very easily. So now I am going to demonstrate about how we can inclinely push the wheelchair. Okay, so here it is, there is more up is there, so I will just lift, then I will push down. So this is how we are just doing the incline. While going down, we should not give more force also. Just try to hold it down and rest your back very much at the back. So slowly you leave it, so that you have to control it and you can go down also. So previously we have seen in this videos are like parts of wheelchairs and what are the basic and intermediate wheelchair skills the person has to learn by themselves, and what are the different propulsion techniques, and at last we have seen that the person how they are going by upstairs and downstairs with the help of one person itself. Okay, so these are the things in this video I tried like little bit summarized and talked about what are the things as an occupational therapist I want from the person to be independent in their life. This wheelchairs mostly were done with the patients with spinal cord injury. That doesn't mean only the spinal cord injury persons have to use this wheelchair. The person who is not walking for so long, at the time that person also can utilize this wheelchairs. Thank you.